The term military medicine has a number of potential connotations. It may mean a medical specialty, specifically a branch of occupational medicine attending to the medical risks and needs of soldiers, sailors and other service members. This disparate arena has historically involved the prevention and treatment of infectious diseases, and, in the 20th century, the ergonomics and health effects of operating military-specific machines and equipment such as submarines, tanks, helicopters and airplanes. Undersea and aviation medicine can be understood as subspecialties of military medicine, or in any case originated as such. Few countries certify or recognize military medicine as a formal specialty, a subspecialty in its own right. The planning and practice of the surgical management of mass battlefield casualties and the logistical and administrative considerations of establishing and operating combat support hospitals. This involves military medical hierarchies, especially the organization of structured medical command and administrative systems that interact with and support deployed combat units. The administration and practice of healthcare for military service members and their dependents in non-deployed settings. This may consist of a medical system paralleling all the medical specialties and subspecialties that exist in the civilian sector. Medical research and development specifically bearing upon problems of military medical interest. Historically, this encompasses all of the medical advances emerging from medical research efforts directed at addressing the problems encountered by deployed military forces, many of which ultimately prove important beyond the purely military considerations that inspired them. Legal status. Military medical personnel engage in humanitarian work and are protected persons under international humanitarian law in accordance with the First and Second Geneva Conventions and their additional protocols, which established legally binding rules guaranteeing neutrality and protection for wounded soldiers, field ships, medical personnel, and specific humanitarian institutions in an armed conflict. International humanitarian law makes no distinction between medical personnel who are members of the armed forces and those who are civilian. The volunteers. All medical personnel are considered non-combatants under international humanitarian law because of their humanitarian duties, and they may not be attacked and not be taken as prisoners of war. Hospitals and other medical facilities and transports identified as such, whether they are military or civilian, may not be attacked either. The Red Cross, the Red Crescent and the Red Crystal are the protective signs recognized under international humanitarian law, and are used by military medical personnel and facilities for this purpose. Attacking military medical personnel, patients in their care, or medical facilities or transports legitimately marked as such is a war crime. Likewise, using these protective signs to mask military operations is the war crime of perfidy. Military medical personnel may be armed, usually with service pistols, for the purpose of self-defense or the defense of patients. Historical significance. The significance of military medicine for combat strength goes far beyond treatment of battlefield injuries. In every major war fought until the late 19th century, disease claimed more soldier casualties than did enemy action. During the American Civil War, for example, about twice as many soldiers died of disease as were killed or mortally wounded in combat. The Franco-Prussian War is considered to have been the first conflict in which combat injury exceeded disease, at least in the German coalition army, which lost 3.47% of its average headcount to combat and only 1.82% of disease. In New World countries, such as Australia, New Zealand, the United States and Canada, military physicians and surgeons contributed significantly to the development of civilian health care. Improvements in military medicine have increased the survival rates in successive wars, due to improvements in medical evacuation, battlefield medicine and trauma care. Similar improvements have been seen in the trauma practices during the Iraq War. Some military trauma care practices are disseminated by citizen soldiers who return to civilian practice. One such practice is where major trauma patients are transferred to an operating theater as soon as possible to stop internal bleeding, increasing the survival rate. Within the United States, the survival rate for gunshot wounds has increased, leading to apparent declines in the gun death rate in states that have stable rates of gunshot hospitalizations. Military medicine by country: North America, Canada, Royal Canadian Medical Service; United States, U.S. Army, U.S. Navy, U.S. Air Force; Europe, France, French Defense Health Service; Belgium, Belgian Medical Component; Germany, Bundeswehr Joint Medical Service; Italy, Corpo Sanitario dell'Esercito Italiano; Corpo Sanitario Militare Marittimo; Corpo Sanitario Aeronautico; Servizio Sanitario della Marina Carabinieri; Russia, Serbia Military Medical Academy; United Kingdom, other regions: Australia, Israel, South Africa, South African Medical Service; Vietnam, Vietnam Military Medical University in Hanoi; India, Armed Forces Medical College.